Late Night Health continues. Coming up in about 10 minutes or so, we're going to continue our discussion of cancer as we talk with a 14-year breast cancer survivor heralding National Breast Cancer Awareness Month. And we'll be talking with Brenda Alyn, no relation, spells her name much differently than I do, about her journey surviving cancer. Right now, we're spending some time with Dr. Eric Presser, a friend of ours here at Late Night Health. He's got a brand new book out. It's an empowering guide to lung cancer, with over 200,000 new cases each year, and more than half of them die, Dr. Presser?
Oh, yes.
I mean,
just reiterating what I said before, we have 225,000 new cases and approximately 160,000 deaths each year from lung cancer, which is why it needs more attention than it deserves, than it's getting right now.
I remember in the 60s and 70s, we always heard about lung cancer. It's somewhat taken a back step, hasn't it?
Well, what everyone remembers the stories about lung cancer being is they knew Joe down the street and he became sick and had a cough, and next thing you know, he had lung cancer and he was gone. And so what that opens up the door to over the last 10 to 20 years, or how can we find this deadly disease earlier? So when I first started writing the book and when I first started giving my lectures, you see, I'm a thoracic surgeon. I'm a minimally invasive thoracic surgeon. So I've always been curious as to how we can find these little guys in the chest earlier, and the only way that we can do that is with a CAT scan. Now, when I give my lectures, I put up a picture of a CAT scan, and I explain to people that a CAT scan is much more sensitive at finding out what's inside the chest. Now, the screening criteria as of today is if you are between the ages of 55 and 77, you are asymptomatic, you are a current smoker, or you quit within the last 15 years, and you smoked at least a pack a day for 30 years or 2 packs a day for 15 years, then Medicare or your insurance company will cover a low-dose CAT scan of the chest. Now, the problem is, what do you do with the information? Because just because we find something on a CAT scan doesn't mean it's cancer. Most of the time it's not. And what I always tell my patients, and a lot of doctors who will listen, because it's all about education. It's all about listing what are your options if something is found, and who do you go and talk to. And that's why my door is always open, and I love looking at scans and answering questions and seeing people who are just scared. Think about it. You know,
it's a scary thing. I remember in high school, in junior high school, they used to show us pictures of healthy lungs and then these blackened charcoals that they said were lung cancer lungs.
Oh, yes.
Right?
And very disturbing. You should see some of the cases that I have. And I always take pictures and I show them, especially when I give lectures to, teenagers or younger people, or whenever I have anyone in the office who is really trying to quit. You have to want to quit, but if you show someone a picture and then you tell them that they have a mass and their whole life is turned upside down, whether it turns out to be cancer or not, many times it's enough to kind of push that person in the direction that they want to go in already. You're just kind of helping them. You have to be their guide, if you will, which is another reason why I wrote the book. Because when you go through it step by step, first you increase awareness, and then if you do find something, you have to know what to do and who to talk to. Once you get a diagnosis, you have to know your options. And then you have to ask the right questions, which is step 4, for example. A lot of people are overwhelmed. They go into a doctor's office, they have no idea what to ask.
And if
they
somebody,
have no idea.
Yeah, if your doctor says, I was just at a pancreatic cancer seminar a couple of weeks ago, and time after time after time, I was talking to survivors, men who were who had been diagnosed, and the doctors would say, "You have cancer. We have to start palliative care." I mean, there's got to be another way.
Well, that's the same thing with lung cancer. Unfortunately, the stigma is it happens in smokers. They deserve it. We've already established that up to 15% of lung cancers happen in non-smokers. We're already trying to find a way to catch it earlier. Now, I always get that question, what if my brother and my father had lung cancer and they were never smokers? We're not there yet as far as the criteria, but anyone can find a way if they're willing to pay for a CAT scan of the chest. It's the only way that we know as of today to try and find an abnormality in the chest.
Is a CAT scan better than an MRI?
Oh yes, much better. Nowadays
detail.
You can get a CAT scan without contrast that takes about 1 minute. You just zip in, you zip out, and then it just shows you exactly if there is anything abnormal. Once again, I reiterate, just because you see something that might not be there, might not be normal or might be abnormal, does not mean you have cancer. But
we're out of time, but here's what I'm going to say. During the holidays, I'd like you to come back during Thanksgiving or Christmas, because that's when a lot of people smoke because of stress from families, and we can continue our conversation. An Empowering Guide to Lung Cancer by Dr. Eric Presser. It's something you should take a look at on Amazon or at your local bookstore. An Empowering Guide to Lung Cancer. Dr. Presser will be back. Maybe I can even have him talk about insurance then, too. All right, more coming up. Late Night Health continues. Brenda Alyn and talking about breast cancer as Late Night Health moves forward.